Why, hello. Happy Thursday. Happy Thursday. I was gonna come in with some type of Jocelyn Hernandez quote, but she ruined it because of all the craziness that she had the other day. Thanks a lot for ruining our fun, Jocelyn. Since you want to Mortal Kombat people, gosh, do it like it's your B-Day. Anyway, hey y'all. Hey. I'm so excited because you guys know it is Thursday, so that means it is NCLEX Jeopardy. On Tuesdays, we have our Tease Tuesday or ATI Tease Tuesday, and that's more so for our entrance exams. So all my pre-nursing students, all my aspiring nurses, that's usually when we get together and have our comprehensive review of math, science. Not really reading in English, more so on the app for that, but we come together and we help you prep for the ATITs. And then fast forward to Thursdays. Thursdays is just reserved for my nursing student baddies, okay? And my nurses, whoever wants to review, because obviously if you don't use it, you lose it. Let me tell you this now, okay? So even even if I wasn't a student anymore and just a working nurse, I would still hop onto NCLEX Jeopardy. It's a free hour of review. It helps me feel like I still, got my skills, got my zhuzh for everything nursing life. Let me look and see. Yay! I'm so glad y'all are finally able to catch it. Hey, boo, hey. Future ER nurse, Smiles and Vibes. How you doing, boo? Where else? CLA. Nola Bay, what's up? Finally, Sandy Ambitious, Pretty Paris. Wait, what time? What? Oh, for the one on Tuesdays, 7 p.m. Eastern Standard, 7 p.m. on Tuesday, 7 p.m. on Thursdays. That's just what time is our right time. I may be changing the times, but I'll let you guys know. Especially with the time change, some people are kind of wanting to do it an hour earlier. Around 6 p.m. Some have suggested 5, so I'll ask you guys that, and I will put that in a poll on Tuesdays and Thursdays. What would be a better time to have NCLEX Jeopardy if you guys still want to change the time and not have it at 7 p.m. Would 5 p.m. work? 6 p.m., 7 p.m.? What would be a better time? Let me know. I'll also put a poll up in my stories so I can see. See, Smiles and Vibes. I always miss ATITs because I have classes at that time. What about 5 or 6? What about that for you, Smiles and Vibes? Hey, Laurelyn. Hey, Just So Her. Hey. Okay, so Just So Her K. Welcome. So you guys know that for our prizes, first of all, we're playing for prizes. Okay. We're going to have 3 winners of the highest points. Whoever has the highest points at the end, the 3 highest points, that's going to be who our winners are. You are going to get a free bundle, study kit, whatever. If you have if you have the Ultimate Nursing School bundle, then you'll get whatever study kit that you don't have, which is probably Critical Care or NCLEX Arcade workbook, as far as everything NCLEX wise. If you have both of those or any of those, just let me know. I'll send you a bottle of study gummies. I don't have it with me. Darn. So those will be your prizes for today. Now, so for you guys that have not been on for NCLEX Jeopardy, this is our free NCLEX review, but Jeopardy style. Y'all know I hate anything boring. I just can't do it. I cannot do it. So that's why I created my study kits. That's why I created the Study Bar community. For me, I have to have fun. I have to enjoy what I'm doing / studying in order for it to stick. It will not stick if I do not enjoy it or if I'm just bored. I will fall asleep over and over and over. And so with me struggling with that in nursing school, I wanted to create something fun and motivating to really help us review while still having fun and enjoying ourselves at the same time. Does this work for the HESI, Exit, PN? I've had a lot of people say, hey, I use your NCLEX whatever for the Exit HESI or the Exit ATI supplementally, and they've all said that they passed, it worked, whatever the case may be. It's all in how you use it. Once again, use it supplementally. It's used, it's the same information. The difference between everyone else's study kits and mine, it doesn't just give you the information. I'm giving it to you in a different way. I'm trying to give you the concept and have you understand the concept in a way that's entertaining, related to pop culture, related to something nostalgic, movies, Disney, I don't know. That's how I studied in nursing school. So that's how I want to help you guys study as well. Let me look and see what you guys are saying. Wait. Oh, you have Michael from 5 to 8. Ooh, Lord. So, all right, guys. So, how you guys play? We have our 5 categories. And hold on, I'm going to show you guys the screen. So, this is what I mean when I say it's like NCLEX Jeopardy style. 1 second. This is what I mean. So, right here. All right. So, you're going to have your 5 categories and 5 answer choices. So, just like the Jeopardy, just like Jeopardy, you have your blue screen, you have your 5 categories, and we have 5 questions per category. So each week you guys get a brand new set of 25 questions. The 5 categories usually varies. For today, we have pharmacology, pediatrics, mental health, fundamentals, and adult health / med-surg. That pharmacology sometimes switches out between pharmacology and dosage calculations, just because both are very equally important. So I like to just switch it up every couple weeks to give you guys the best of both worlds. Now, this is how we're going to play. So I'm going to read out the question. I'm going to read out the answer choices. And you guys are going to type in the comments what is, and then whatever the answer is. So it is multiple choice. It's no select all would apply for here at least. So it's a multiple choice. So the answers are going to be 1, 2, 3, or 4. Quick tip, especially for those that have not played yet. Everyone's going to be answering super fast. Okay. With the internet and connectivity, it may lag on your screen versus my screen. So whoever answers first on my screen is going to be who's going to be the winner. I can't see your screen, unfortunately, so I can't really, go by what your screen says or Mary Jo or whoever. Unfortunately, I can just go by what my screen says. If it does differ, I apologize for that. I can't control the connectivity and the lagging. But if you missed that question as far as being first, remember, we're only playing for fun and to make it motivating and studying and actually fun. But the actual purpose of this is for you guys to comprehend and get the answers correct. It doesn't matter if you're, first or second or whatever, third on the NCLEX, on the real thing. As long as you get the answer correct, that's what we care for. This is just adding a little zhuzh to it because it's boring any other way. Hey, boo, hey, Tiff. Y'all follow New Nurse Academy. You don't have to write the answer out. That will take way too long. So literally just put 1, 2, 3, or 4, but you have to say what is. Okay, so my advice is to go ahead and type in the comments what is, like in the little bar, type in what is, and then copy and paste that thing. So every time we have a question and you have to answer, all you gotta do is paste what is, and then you just say the answer, 1, 2, 3, 4. So it should be what is 1, 2, 3, or 4. Okay. There is not a download link to this, but for the game, for the actual play on the app, the mobile version, you can download the Nurse Sam app. You'll probably see 2 different apps, the Nurse Sam and Study Bar. Study Bar is exclusive to members only. You are more than welcome to join. I actually encourage you to join because that's going to be the only place for you to access any of these replays. Right now, we have like over 20 different replays of ATITs, tutoring replays, and NCLEX Jeopardy replays. So you have more than 24 hours of video review and replays in the Study Bar alone right now. So that's $29.99 a month. It's our new monthly membership. So once again, the only way to access this this replay is if you are joined and registered for the Study Bar community. Okay. Other than that, you can still download the Nurse Sam app. And when you download that, it's completely free for everybody. When you download that, click NCLEX Prep. You'll see NCLEX Jeopardy Mobile. And that's when you'll be able to play the mobile version of what we're about to play right now. Questions won't be updated until after we get through it, because obviously it would be cheating, So last week's questions are now there for you guys to review. But after we get finished with our review, I'm going to update them so you guys can see the same questions we went over, so you can go ahead and review with yourself, with some study buddies, wherever, on the train, in the bathroom, wherever. wherever, okay? That's the whole point of having the app, so you guys can have anytime, anywhere studying, okay? All right, so let me see if y'all have any questions. All right, see, Law already got it. Make sure you have what is ready. Cut, copy, paste, whatever you need to do, because that is definitely how you're going to beat and shave off a couple seconds, okay? All right. All right, so we're going to go ahead and get started. Once again, these are our categories: pharmacology, pediatrics, mental health, fundamentals, and adult health / med surg. So let's go ahead and get into it. What's going to be our first question, and for how many points? Let's do fundamentals for 400. Sure. Fundamentals for 400. Remember, we are playing for prizes, right? We are playing for prizes. So once again, the top 3 participants with the highest score will receive a free Ultimate Study Kit bundle, free NCLEX Arcade, whatever, which one you don't have, that's what you get. We're going to start with the Ultimate Study Bundle. It usually goes for $97, but I keep trying to tell y'all, if y'all don't have it, if y'all want to also get a review in and have the option and the chance of winning a free bundle, there's nothing better to do than come to NCLEX Jeopardy. It's free bundles, right? All right, so let's go ahead and get into our first question. Let me get my scoreboard out. All right, guys, got my scoreboard, my handy dandy pen found in the Nurse Life Planner, and let's go ahead and get into it. Fundamentals for 400. Ready? A client is to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. What instruction should the nurse provide to the client regarding management of the urine as a biohazard? 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the toilet with bleach after voiding for 6 hours after a treatment. 3. Purchase extra bottles of scented disinfectant for daily bathroom cleansing. 4. Have one bathroom strictly set aside for the client's use for the next 2 months. What is our answer? Remember, you have to say what is in order to count, okay, as correct. I'm going to read it again. Run that back. A client is to undergo weekly intravesical chemotherapy for bladder cancer for the next 8 weeks. What instructions should the nurse provide to the client regarding management of the urine as a biohazard? 1. Void into a bedpan and then empty the urine into the toilet. 2. Disinfect the toilet with bleach after voiding for 6 hours after a treatment. 3. Purchase extra bottles of scented disinfectant for daily bathroom cleansing. 4. Have one bathroom strictly set aside for the client's use for the next 2 months. What is going to be our answer? All right, let's look and see what you guys are saying. Wait for it. Wait for it. Okay, so this one must have been tricky because I even got it wrong. The answer is actually 2. What is 2? Disinfect the toilet with bleach after voiding for 6 hours after treatment. The first person to get that was Future Nurse 99. Because everybody, including me, said 4, which was have one bathroom set aside for the client's use for the next 2 months. That's the answer. Listen, y'all know I will not lie to you. I'm studying right along with y'all. I'm not in school. But, you know, I love to refresh my memory as well. But I would have chosen 4. So a lot of people chose 4. Let's dive into why. So it says the answer is what is 2, once again. Disinfect the toilet with bleach after voiding for 6 hours after treatment. Rationale says after intravesical chemotherapy, the client treats the urine as a biohazard. This involves disinfecting the urine and the toilet with household bleach for 6 hours after the treatment. Using a bedpan for voiding is of no value in this situation, so number 1 is out. Scented disinfectants are of no particular use. So that was number 2. Number 2 is out. And then it says the client does not need to have a separate bathroom for personal use. So 4 is out. But to me, wouldn't that be setting, making it, oh, okay, whatever. Okay, I get it. It doesn't have to be separate. They just have to disinfect the seat. You see why you have to come to NCLEX Jeopardy? Because we all would have got that thing wrong. Except for Future Nurse 99. So, Future Nurse 99, good job in getting that, honey, because, whoo, I was loud and wrong. Where are you? One second. There you are. Future Nurse 99. You are on the scoreboard with 400. Listen, you deserve that 400 because wrong. All right, so let's see who else got what is 2. Teddy Burrow Love. I see you said B ? But remember, and then you said 2. Remember, this is NCLEX Jeopardy, so remember to put what is at the beginning of your answer. So just copy and paste what literally the phrase what is, and then just copy and paste it every time we have a question. It'll save you so much time. And then put the answer. But yes, you were correct. You weren't first, but that's okay, because in the NCLEX, you would have been one of the few to get it. I would not be on that list. Okay. Teddy Burrell, once again, great job. Molly, me neither. I would not have said that. It was between 2 and 4 for me. Yeah, it would have been 2 and 4 because I knew the bedpan was nothing. And then the scented disinfectant, the fact that it was scented threw me off. That's why I totally did away with it. Like, they're getting chemotherapy and it's something scented in the room. I just feel like that's a no-no. Flush the toilet twice. Is that real, Ash Cash? Oh boy, is that really a thing? You have to flush the toilet twice when you're treating the urine as a biohazard? Good to know. Let me know. That's too much going to them. Is it radiation that is a separate bathroom? Good question. I think it is. Is it radiation that makes you require a separate bathroom? I believe it is. Radioactive waste, absolutely. Great job. That was a 1 like on that. Like on that one. Great job, guys. You see how the wheels be turning? So proud. Okay, awesome job, guys. Let's go to the next question. Ash Cash works on the oncology floor of the hospital, so she knows. She knows, all right? Flush twice. So radiation is why it's separate. So remember that. That was a good one. Not chemotherapy, but radiation is why the bathroom will be separate. So everybody that chose number 4, you were thinking about radiation. That's not what the question said. It said chemotherapy, intravesical chemotherapy. So that just requires spray and scrub with bleach after 6 hours after treatment. So this is why you're here. Exactly. All right, let's go ahead and go to our next question. Let's do mental health for 300. Let's do mental health for 300. All right, so remember, guys, this is our free NCLEX Jeopardy review, Jeopardy style. So if you're just new to the room, remember, I am reading out the questions. I am reading out the answer choices. Because this is Jeopardy style, you have to say what is and then the answer. You don't have to write out the answer. Just say the the number 1, 2, 3, or 4, and you'll count. We have to go for whoever answers first on my screen. Right now, we have Future Nurse 99 on the scoreboard with 400 points. We have 3 winners for tonight, so it could be anybody's game. All right. Once again, our question for right now, we are choosing mental health for 300. All right. A client diagnosed with depression is not eating adequately and at times even refuses to eat at all. What should the nurse plan to do to meet the client's nutritional needs? 1. Force foods and fluids. 2. Restrict social activities until food intake is increased. 3. Promptly provide snacks and meals when the client requests them. Or 4. Provide small, frequent meals that include the client's food preferences. I'm going to read that one more time. Run that back. All right, a client diagnosed with depression is not eating adequately and at times even refuses to eat at all. What should the nurse plan to do to meet the client's nutritional needs? 1, force foods and fluids. You're going to drink this. 2, restrict social activities until food intake is increased. 3, promptly provide snacks and meals when the client requests them. Or 4, provide small, frequent meals that include the client's food preferences. What is going to be our answer? All right, let's look and let's see what you guys are saying. Let me scroll all the way to the top. All right, hold on. First, okay, so our answer is, what is 4? Provide small, frequent meals that include the client's food preference. What is 4? First person to get 4, I'm seeing some 3s. First person to get 4 is Blexy. Hey, Blexy. You are on the scoreboard with 300 points and in second place right now, so great job. You're right behind Future Nurse 99 that has 400 points. So great job, guys. Now, let's go ahead and get into, well, who else got what is 4? 1 second. Queen L, Zokia, Ash Cash, Future Nurse, 22 Chrissy, Juju Bean, Forever Desiree, NC Pink Rose. Is that it? Wait, no, where'd it go? Sleazer? SLZR? I'm not sure. Amber Deneen, remember to put what is. M. Grunfield, Darlene, Sweet Tea, Heart Like Gold. Just in case y'all are new to it, remember we have to go by what's on my screen. Your screen and my screen may lag because of connectivity. It is Instagram, it is on live, I don't know. So I can only go by what's on my screen first. And on my screen, it was Blexy, unfortunately. But remember, that's not the point of this. The point of this is to make y'all motivated so you can study more and comprehend more. Prizes are just for incentive, but as long as you're answering the correct answer period, you're winning, okay? All right, Robin 48, great job. Sheikah. Kiss my asteroid said I'm stuck between 3 and 4. It was 4, boo. Law, that was great. You chose 4. Melanin Nurse. Craig Rochelle, Numb Beauty. I changed to 4 real quick. Right, force foods. You're trying to get your finger bit off or threw up on because it's gonna come out. Right. Yeah, exactly. I'll read the rationale too as far as that. When I heard client preference, I said, damn, that's the answer. Yep, pretty much. Did you see me? Let's look. Wait, I didn't see you, Lee MSX. Let's look. Hold on, let me go back up. Let's do one more. Yeah, I just verified it one more time. So Blexy was the first person to get it. If your answers didn't come through on my screen, I'm not sure why, but like I said, connectivity. But as long as you know you got this correct answer, good. Because people were between 3 and 4, and 4 was the correct answer. Definitely come out on top. All right, so this is the rationale as to why it was 4 instead of 3. So 4 says, provide small, frequent meals that include the client's food preference. Remember, the question is saying that the client was diagnosed. And then rationale says a depressed client may eat small amounts of food because large amounts may seem overwhelming. In addition to that, sometimes y'all ever just been in that phase of that depression, that really dark sadness that either you want to eat everything or not eat at all. So this client, they're not eating adequately when they're depressed. So even if it's large amounts of food or small amounts of food, they can quickly become overwhelmed. It says if the client becomes overwhelmed, he or she may respond by withdrawing even further. Okay, forcing foods and fluids and restricting social activities will cause further withdrawal by the client, since both will be viewed as a punishment. Like, I'm already depressed. Like, I know that I need to eat, but I just don't have an appetite right now. Like, are you really going to punish me because I can't eat? Do you want to force feed me? I will throw up on you. Period. So no, we don't want to force feed foods or fluids, and we don't want to restrict social activities, even if it's for their best interest. In this case, it's not in their best interest. Once again, it's going to make them withdraw even further. I'm sorry, but you're not gonna tell me what I can and cannot do, love. You're not. But yeah, especially something like this that is definitely not medically necessary. Restricting my social activities, I will get my daughter to call you, ma'am. All right, so once again, forcing foods and fluids and restricting activities will cause further withdrawal by the client/patient, since both will be viewed as a punishment. It's not their fault they're depressed. It's not their fault that they can't eat. It's our job to take that situation that they're in, knowing that they're depressed and not eating adequately. What can we do to raise their interest to wanting to eat? So first thing you would think about is, maybe try presenting them with foods that they actually like, that they prefer. And then it says providing snacks and meals when the client requests them. That's not necessarily going to ensure adequate nutritional intake. Remember, they're not eating adequately. And even at times they're refusing. So the times that when they do want to eat, it's still not adequate. So even if you rush to their aid, or here's a Big Mac, or here's a banana or whatever, they're still not eating adequately in the first place. You understand me? So that's why 3 was not the correct answer, because their issue isn't no one's coming to me with my food issue. Their issue is I'm just not hungry when I need to be, and I'm not taking in the adequate amount of calories / nutritional needs in order to function. All right, make sense? Right. All right, so that was that was mental health for 300. Great job. All right, let's go to our next one. Let's do adult health for 500. Let's get a little in there, okay? All right, adult health for 500. This is the same thing as med-surg. One second. Yeah, this is the same thing as med-surg, but we call it adult health once again because we have pediatrics as well. So we just want to make sure that you know that we're talking about the adult body of med-surg, not just pediatrics or anybody as a whole. All right, so the nurse, adult health for 500, the nurse is caring for a client who had an above-knee amputation 2 days ago. The residual limb was wrapped with an elastic compression bandage, which has come off. Which immediate action should the nurse take? I'm sorry for going like this, but I want y'all to get emphasis on the word which immediate action should the nurse take. On NCLEX, words mean things. Okay, they're not just randomly throwing out adjectives and just priority words just all willy-nilly. They mean things. Okay, if it just said which action should the nurse take, know that it's very different from which immediate action the nurse should take. As you take more and more, you'll start to recognize these priority words. But let me point out this one to you. Which immediate action should the nurse take? 1, apply ice to the site. 2, call the primary healthcare provider. 3, rewrap the residual limb with an elastic compression bandage. Or 4, apply a dry, sterile dressing and elevate the residual limb on one pillow. Especially ATI. Especially ATI. ATI has its own language, I swear to you. It has its own language that really you can only know get and catch on to if you do a whole bunch of ATI questions. It's weird. We'll go into it though. But anyway, I'm gonna repeat that one more time, y'all. The nurse is caring for a client who had an above-the-knee amputation 2 days ago. The residual limb was wrapped with an elastic compression bandage, but that has come off. Which immediate action should the nurse take? 1, apply ice to the site. 2, call the primary healthcare provider. 3, rewrap the residual limb with an elastic compression bandage. 4, apply a dry, sterile dressing and elevate the residual limb on one pillow. What is going to be our immediate action that we're going to take? All right, let's look and see what that answer is. What is 3, rewrap the residual limb with an elastic compression bandage. I always sucked at wrapping with compression bandages. I just couldn't do it. But yes, that is the answer. Rewrap the residual limb with an elastic compression bandage. Let's see who's the first person to get what is 3. Sure. All right. What is 3? Wait for it. Chriselle, Unknown Beauty. Unknown Beauty is first with what is 3. Hey, boo, hey. You are on the scoreboard. Beauty with 500 points. You see what I mean when I say it could be anybody's game? 30 minutes later, Unknown Beauty is now on the scoreboard and already in first place. It's crazy, right? That's why we have points that range from 100 to 500, because it can be anybody's game. Somebody can swoop in at the last second and just get like a 500 pointer and just win the whole thing. All right, so once again, Unknown Beauty, great job. You were the first person to get that answer correct. Let's see who else got what is 3. Queen L, you're quickly behind her. Strong Liz, Nola Bay, 22 Chrissy, Exchange 27, Future Nurse 99, 2 High Class for you. Remember to put what is, my love. Great with the Chriselle with the rationale, the limb can become edematous if not wrapped again quickly. 4 was apply a dry, sterile dressing and elevate the residual limb on one pillow. Right, it was that pillow, but we'll talk about the rationale in just a second. Let me do all my shout outs. Okay, everyone that got what is 3, great job. Great job to you, Chriselle. You are on the scoreboard with 500. All right, so this is the rationale, guys. Take note. If a client with an amputation has a cast or elastic compression bandage that slips off, like someone's sock, the nurse must wrap the residual limb immediately with another elastic compression bandage, period. Otherwise, excessive edema will form rapidly, okay? Which can also cause a significant delay in rehabilitation. Remember, they just got that above the knee amputation 2 days ago. 2 days, no. All right, so we want to avoid excessive edema or swelling by rewrapping that elastic compression bandage, okay? So if the client had a cast that slipped off, never heard of a cast slipping off, but okay, the nurse would have to call the PHCP, Dr. Shepard, Dr. Gray, Lil Mama's boot came off, her cast came off. First of all, they'd be like, how the hell did it come off? But that's a conversation for another day. Anyway, you would call the PHCP so that a new one can be applied. Remember, you have to get orders for these things, so that's why you would call first. Scope of practice, okay? It says elevation on one pillow. This was number 4. Elevation on one pillow is not going to impede the development of edema greatly once compression is released. Ice would be of limited value in controlling edema from this cause. Ice would probably be like pissing in an ocean as far as trying to prevent swelling from a freshly amputated limb. But no, please rewrap first. And then if the PHCP were called, the prescription likely would be to reapply the compression dressing anyway. That most likely would be a standing order. So that's why the first immediate action would always be to rewrap, because more than likely, actually there very well should be an order to apply the bandage, PRN, if it falls off. That's a standing order that an LPN can do and an RN can do. Okay, let me look at what y'all are saying. It's okay. Hey, Nye, we prepare for teas on Tuesdays, and also in the study bar community. All right, so that was what is 3. Great job, guys. Let's go on to our next question. Let's do pharmacology for 400. No. Which one should I do? Sure, let's do pharmacology for 400. Y'all ready? Tag your nursing student friends. Tag your student graduate nurses that have graduated from nursing school but are preparing to take the NCLEX, so they're not legally a nurse yet. Tag everybody that needs help with studying. You don't even have to be taking the NCLEX. You could just be in school, about to take maybe a nursing school exam. There's no better time to study for the NCLEX except for when you get in. That's my recommendation. Start studying and prepping for the NCLEX as soon as you get that acceptance letter, love. It's do nothing but help you in the long run. All right, so tag anybody that may need this review. We're about to get into pharmacology for 400 points. You can join the community. There's a link in my bio, and then you can hit join the community, or you can go to studybarcommunity.com. All right, wait. I'll put that in there at the end. Okay, perfect. All right, so pharmacology for 400. The nurse is providing medication instructions to a client with breast cancer who is receiving cyclophosphamide. Cyclophosphamide. The nurse should tell the client to take which action? I'm going to repeat the question one more time and then go into the answer choices. The nurse, LPN or RN, is providing medication instructions to a client with breast cancer who is receiving cyclophosphamide. The nurse should tell the client to take which action? 1. Take the medication with food. 2. Increase fluid intake to 2,000 to 3,000 milliliters daily. 3. Decrease sodium intake while taking this medication. Or 4. Increase potassium intake while taking this medication. Ooh, which one is it? Which one is it? Which one is it? I'm going to repeat it one more time. All right. The nurse is giving client teaching medication instructions to a client with breast cancer who is receiving cyclophosphamide. The nurse should tell the client to take which action? 1. Take the medication with food. 2. Increase fluid intake to 2,000 to 3,000 milliliters daily. 3. Decrease sodium intake while taking the medication. Or 4. Increase potassium intake while taking the medication. What is going to be our answer? What is going to be our answer? All right, our answer is, what is 2? What is 2? Increase fluid intake to 2,000 to 3,000 milliliters daily. Oh, wait. Oh. Okay, I'm good. Sorry. Yes, what is 2? You're supposed to increase your fluid intake. You want to take in about 2,000 to 3,000 milliliters, which is also 2 to 3 liters daily. All right, that's what you want to do. Ooh, someone said it's always fluid. As you take more of these questions, you start to recognize a trend. That's why practice is so important. That's why I do this with y'all every Thursday and Tuesday for HITs, but I do this with you every Thursday. And I'm pretty sure some of y'all that have at least come to the last 3 can account to some of these questions repeating itself. Like maybe not the exact same question, but the exact same concept, just in different words. So like, did we just have this? There's only so many questions you can ask about the same thing. And so to make sure you have, it comprehended. So the more you take, the more you comprehend, the more you get it down, the more easier it will come. Practice literally makes perfect, okay? All right, so rationale says, hemorrhagic cystitis. Ooh, hemorrhagic cystitis is an adverse effect of cyclophosphamide, all right, that can occur with the use of cyclophosphamide. Did y'all know that? I didn't. I surely did not. Okay, so it says, since I didn't know it, if I were you guys, I would just go ahead and write on my little notepad. Hemorrhagic cystitis is an adverse effect of cyclophosphamide, which is used to treat breast cancer. Just go ahead and just write it down. All right. It says the client needs to be instructed to drink copious amounts of fluid during the administration of this medication. Clients should also monitor urine output for hematuria, or blood in the urine. The medication should be taken on an empty stomach, not with food, unless GI upset occurs. Hyperkalemia, which is high potassium can result from the use of this medication. So you definitely don't want to increase potassium while taking it. You'd want to decrease. So 4 is out because it said that you should tell them to increase the potassium. All right, that's not what you want to do because they're already at risk for hyperkalemia. And you guys know, if you don't know, well, now you know that anything having to do with like the potassium, one of the first things your mind's should go to as a nurse is that it's going to immediately affect the muscles. One of the most important muscles is the heart. All right, that's gonna cause like arrhythmias and all sorts of cardiac problems. Okay, you don't want those problems. So hyperkalemia, you don't want to add to the imbalance of potassium at all. All right, cardiac arrest, absolutely. It says therefore, I already said that. You would not be told to increase potassium. You'd be told to decrease potassium. Quick question for 100 points. Give me okay, never mind. Wait, hold on. Let me finish saying this. And then as far as the sodium intake, it says the client would not be instructed to alter sodium intake at all. So 3 is out. You wouldn't be instructed to decrease it or increase it. The fact that they are increasing fluids though, it would obviously be electrolytes inside the fluid. So with that fluid intake, you will also just make sure that you're not diluting your blood or your body. But if you're getting whatever. Anyway, yes, the answer is what is 2? Increase fluid intake to 2,000 to 3,000 milliliters daily. This is going to be the question that I asked. Name a food high in potassium. I can't really say name a food low in potassium. Is that a thing? Name a food high in potassium, but you would obviously tell this client, stay away from these kinds of foods. So that's really the big thing whenever you're telling someone to decrease, stay away or don't increase this amount of food. You're really telling them to stay away from foods that have high potassium. Like, off the top of my head, I don't know a food that has low potassium. Like, I know foods that have high potassium, that just comes to my mind real quick. But for the nurse in teaching, you would obviously tell the client, okay, if you are trying to decrease potassium intake, you would want to stay away from these foods that are rich in potassium, like bananas. Correct. That's the first thing that my mind goes to. What about y'all? First thing is bananas. But I love to have at least a second one just in case, because let's be honest, bananas is super easy. So sometimes the NCLEX will come at you with a different alternative to make sure you know that what's another type of food, just in case that client was gonna be like, what else? I don't like bananas. So what's another food that I have to avoid or something like that? You have to know another food that's high in potassium, because it's not just bananas. Avocados, green leafy vegetables, absolutely. It's like spinach and nastiness like that. Oranges. Yes, oranges. It's really high in potassium. Absolutely. And potatoes. Look at y'all. Great job. Grapefruit, raisins. Ew. All right. So, that being said, did I say who got the answer? Let me look. 1 second. Who was the first person? I did all that and I didn't even announce the winner. It was Smile16. Hey, Smile16. Hey, boo. Welcome back onto the scoreboard. Smiles is another one that comes in and just racks up all the points. So I'm telling y'all, make sure y'all cut and paste what is, because you have people like Smiles, future ER nurse, Unknown Beauty that just come and just take all the points, okay? Now, they're serious about their prep, okay? Just like you guys need to be. All right, so Smile16, congrats, boo. You're on the scoreboard with 400 points. So right now we're in first place, Unknown Beauty with 500 points. Tied for second, we have Future Nurse 99 and Smiles with 400. And then Blexy, you are in third place with 300 points. We still have 20 minutes. All right. Let's go ahead and go to the next question. Boop, boop, boop. Oh, here's a fun fact. There's more potassium in the skin of an Idaho potato than a banana. Bananas are just more popular. They're just a very known popular fruit that has bananas. That has potassium. But statistically, there's actually more in the skin of an Idaho potato. Okay now. Okay. Period. All right, so let's go ahead and go to our next question. All right. Now we have to do pediatrics. Let's do pediatrics. Let's do pediatrics for 200. This one's a good question. All right, pediatrics for 200. The nurse is monitoring an infant with heart failure. Which sign alerts the nurse to suspect fluid accumulation and the need to call the primary healthcare provider? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. Or 4. A weight gain of 1 pound in 1 day. This is pediatrics for 200. The nurse is monitoring an infant with heart failure. Which sign alerts the nurse to suspect fluid accumulation and the need to call the primary healthcare provider? 1. Bradypnea. 2. Diaphoresis. 3. Decreased blood pressure. 4. A weight gain of 1 pound in 1 day. If I'm wrong, I'm gonna be so mad. Okay, good. Woo! All right, so let's look and see what our answer is. I know it already, but let's look and see who got it first. All right, our answer is, what is 4? Weight gain of 1 pound or 0.5 kilograms in 1 day. What is 4? A weight gain of 1 pound in 1 day. First person to get that on my screen, please don't cuss me out, was, wait for it, 22 Chrissy. 22 Chrissy underscore. I think it's 2 underscores. Chrissy. Awesome job. You're on the scoreboard with 200 points. All right. Let's see who else got what is 4. 22 Chrissy got it first. Then Unknown Beauty. She inspires her. There we go. SLZR. Zokia. Katie K. Remember to put what is. Shayna. Tijuana. CLA, C Lady, M Grunfield, wait, no, sorry, not M Grunfield, CLA, C Lady, Future ER Nurse, got what is 4, wait for it, I was trying to type it with you, that's funny. Someone said D or 4, yes, maybe I'm a lion, absolutely, great job, guys. All right, so let's go into why it was what is 4. Let me see what else. A lot of people are saying 2. Well, that 2 and 3, a lot of people are saying 2. But honestly, everybody said a little bit of everything. So let's go over the rationale so you can know how to answer this question next time you see it. All right, so it says heart failure is the inability of the heart to pump a sufficient amount of oxygen to meet the metabolic needs of the body. A weight gain of 1 pound in 1 day is caused by the accumulation of fluid. That is rapid weight gain. The nurse should assess urine output. Assess for evidence of facial or peripheral edema, aka fluid accumulation within the soft tissues of your face. Auscultate lung sounds. See if you can hear any crackles. And report the weight gain to the primary healthcare provider. All right, tachypnea, which is fast breathing, and increased blood pressure actually occur with fluid accumulation. The question answer says 1 was bradypnea, which is slow breathing. So that's out because you would actually see fast breathing, aka tachypnea, with heart failure / fluid accumulation. And then 3 was decreased blood pressure, but once again, you would see increased blood pressure with fluid accumulation. Diaphoresis, that is a sign of heart failure, but it's not specific to the fluid accumulation. And it usually occurs with exertional activities. All right, you're usually really sweating if you just did Beyonce's halftime show or something like that. You'd probably be a little bit diaphoretic, more than usual. Or if you're trying to go up the stairs, really, because honestly, you would not be doing no Beyonce choreography if you have heart failure. But even just doing something like, exerting any type of energy, walking down the stairs or walking down the hall, it's going to be like you ran a lap or something like that. Diaphoresis or excessive sweating would be a sign. However, once again, that is not specific to fluid accumulation. Let's go back to the question. It said, which sign alerts the nurse to suspect fluid accumulation? All right. Now, once again, as far as that fluid accumulation, if you're gaining 1 pound a day, that is definitely a high alert that you're retaining fluid. Usually, the providers would put really anybody on heart failure, but specifically anybody that would be suspected of fluid accumulation on daily weights. Can y'all tell me when is the best time to get someone's weight? I'm asking you this now because I promise you, NCLEX or one of your nursing school exams either has already asked you this question or they're going to ask you this question. I guarantee it. What is the best time? Yay! What is the best time to get your client's weight, to get your patient's weight? You're going to need to know it. I promise. This is one of the questions that you need to know both in school and when you get out, especially if you work bedside. So if you go do long-term care, if you go do, like I said, bedside, long-term care, home health, was one that we had to do it all the time. Assisted living, anybody's hospital med-surg floor. That is one of the ways to monitor a patient's weight. So you're expected to know when the best time is to get the most accurate weight, okay? First thing in the morning, same time every day. Amen. Same time, same scale. Ooh, I can't with y'all because I'm so proud. Y'all are just giving me detail on detail. I'm so glad y'all are saying all that. Same time, same scale. First thing in the morning, same amount of clothing. Amen. Awesome job. Absolutely. Do you want to do it before or after voiding? Question. Answer questions that need answering. Do you want to collect the weight before or after the first morning void? What we're doing? Let me see. Are we collecting daily weights before or after voiding? I'm getting after. I'm getting a before. It's actually after. I had to check to make sure, to be honest. Yeah, it was confusing me. You have to do it after you empty your bladder and before you eat or drink something. After you empty your bladder, but before you eat or drink anything. So you can wake up and take a little morning piss. That's fine. So you don't have that extra, pound of, urine that's sitting on your bladder. But before you drink or eat anything, go get that weight. So after urinating, before brunch with the girls. Awesome job. But yes, and it should still be at the same time every day. So that's usually when you as a nurse would get them into the habit Make sure that they know those very two important parts. After voiding, before eating. I know breakfast is at this time, so let's go ahead and make sure you get your weight before then, so you don't have to smell nobody's bacon, nobody's no salt diet or whatever, and you have yourself be tempted. So that's one of the roles of the nurse, to make sure that patient is as comfortable as possible so you can get that weight and they're not like missing out on breakfast or not holding, they wouldn't hold that urine because they would actually go after the urine, but they would have to, wait and postpone breakfast, and that's not what you want. Okay? For any patient. You mess with their food, just don't do it. All right, let's go ahead and go to, did I say who got that one? Yes, 22 Chrissy. Okay, perfect. Yep, okay, great. All right, let's do one more. And let's do a 500 pointer. That one's dark. I don't want to do that one. Okay, let's do this one. Pharmacology for 500. Pharmacology for 500. Farm for 500. All right, I'm going to read the answer. I'm going to read the answer choices. All right. The nurse is completing a health history for an insulin-dependent client who has been self-administering insulin for 40 years. The client reports experiencing periods of hypoglycemia, followed by periods of hyperglycemia. What is the most likely cause for this pattern of blood glucose fluctuation? Is it 1, eating snacks between meals? 2, initiating the use of an insulin pump? 3, injecting insulin at a site of lipodystrophy? Or 4, adjusting insulin according to blood glucose levels? What is the most likely cause for those client-reported periods of hypoglycemia followed by periods of hyperglycemia? All right, what's the cause of that pattern of blood glucose fluctuation? Is it 1, eating snacks between meals? 3, initiating the use of an insulin pump? 3, injecting insulin at a site of lipodystrophy? Or 4, adjusting insulin according to blood glucose levels? What is our answer? Let's look and see. Let me scroll to you guys answering these questions. All right, the answer is, what is 3? What is 3? Injecting insulin at a site of lipodystrophy. I don't know how to say those words. Yes, lipodystrophy. All right, first person to get what is 3 on my screen. One second. Unknown Beauty. Hey boo. Hey boo hey. Benta Crib was right under her, but Unknown Beauty comes in at you got 1,000 points now because you had 500 points, and then you came in and scooped this one up. So now you have 500 plus that 500 to give you 1,000. You hit the 1,000 club this episode. Great job, boo. All right, so once again, Chriselle, aka Unknown Beauty, was the first person to get that answer. Bint Akib was nice in second. Great job, boo. 22 Chrissy, I see you. Kira, Brianna, great job. Tijuana Williams, Katie K. Sandy Ambitious. I went back and forth. No, do not throw hands up. Remember, that's why we are here. Listen, you can get the questions wrong with me, because let me tell you something about me. I do not care about getting questions wrong in front of y'all. I love you. I just don't. I don't. I'm already a nurse. I already know that I haven't used it in a long time, so I'm going to lose some things. But that's why we do NCLEX Jeopardy. You can get the questions all you want. Get the questions wrong all you want in front of me, because that's the whole point. All right? Think of me as your coach. Get it wrong. We in dance practice, you got to look ugly for a couple practices, and then you start to look cute. Whatever. But as long as we practice on Thursdays, it does not matter how ugly you look, doesn't matter how many questions you get wrong, because at the end of the day and at the end of the question, we go over why it's correct or why you got it wrong in the first place, so that you don't make that same mistake again. So don't beat yourselves up about getting the questions wrong. You can beat yourselves up if you get a question wrong, like after we go over it like 3 times. You know, that can be something. Maybe that's a learning style thing. But, you know, one question off, and you were between like 2 and 4, you were between 2 different answers, you just chose the wrong answer. At least you was 50% there. Change the way you look at it. Change your perspective, because the more you down yourself, the more that test anxiety is going to go up, and you're just going to like hate. You're going to hate your nursing school experience and be one of those bitter nurses that work at whatever place and just hate everything nurses and hate everything about nursing as a whole just because of that experience, which is why I do this. Okay, I do not want everybody to become bitter nurses that just hate everything nursing school because of the anxiety we experienced in nursing school. Okay, it ain't worth it. All right. So woosah, let's get back on the horse, get back on the saddle, and let's go over why we got this question right or wrong. All right. So it says the answer once again is, did I say the answer? It's what is 3? What is 3? Injecting insulin at a site of lipodystrophy. All right. It says tissue hypertrophy or hypertrophy, aka lipodystrophy, involves thickening of the subcutaneous tissue at the injection sites. All right, this dense tissue can interfere with the absorption of insulin, resulting in erratic blood glucose levels. Because the client has been on insulin for many years, this is the most likely cause of poor control. The remaining options are appropriate for use in regulating blood glucose levels, but the answer 3 is definitely going to be our most likely cause for this poor control. All right, so remember, back to the question, it said the nurse is completing a health history for an insulin-dependent client. If you have an insulin-dependent client, what type of diabetes do they have? Type 1 or type 2? Insulin-dependent diabetes. Insulin-dependent client, what type of diabetes do they have? Type 1 or type 2? Type 1 or type 2 for insulin dependent. Which is it? Always. I'm going back through your answers 1 second. Who said what is 3 first? I think I said, yeah, it was you. Let me look. And like I said, with the whole internet connectivity maybe lagging, it is Instagram. No shade Instagram, but y'all gotta do better with some of y'all connectivity stuff. But yes, Chriselle was the first person to get it. But she did not answer. She did not answer before I said the option choices. Definitely not. So it may have just been lagging as far as the screen for you goes. All right, let's go and see. Hold on 1 second. Type 1, absolutely. Great. I was looking for it. Type 1, absolutely. Insulin-dependent clients suffer from type 1 diabetes, which means they usually get diagnosed in their adolescent years. And it doesn't really have anything to do with diet, exercise. So that's type 2. When it's more like lifestyle modification, and you've developed diabetes because of lifestyle choices, that is non-insulin dependent, aka type 2. When insulin dependent, it's type 1, and that is important because once again, they have to take insulin for the rest of their life. All right. So once again, that injecting the insulin at a site of lipodystrophy, aka where that tissue is just hypertrophied or just really, really thick. Think about injecting, honestly, any type of liquid into a thick something, like trying to get through a thick barrier Okay, example. Me injecting something, don't laugh at my mask. Me injecting something into, think of this as regular subcutaneous fat, all right? In order for me to inject something, in order to get into wherever it needs to go, back here, the muscle or whatever, it needs to go through, there, it needs to go through that, the subcutaneous tissue, so it should not be thick. Now imagine if this tissue was hypertrophied and just really, really thick. That'll be like, think of this as hypertrophied tissue, okay? This is your needle, all right? You want the insulin to go over here in order for it to work. But if you are taking this little small, and y'all know how small these insulin needles are, they're literally like that big. If you are taking that and putting it into where you think it should go all the way through if it was thin, but because this is so thick and hypertrophied, when you put it all the way through, it's not getting to where it needs to go. So that's going to definitely account for the fluctuation, because you're not getting the adequate amount of insulin that they regularly would be getting if there wasn't that hypertrophied tissue. Does that make sense with that visual? With the thin wall and the thick wall? All right. Usually what you're supposed to do, okay, and they teach you this like in fundamentals, you're supposed to rotate those injection sites. Now, insulin is usually given, how is insulin given? Real quick, how's insulin given? What route? Oh yeah, what route is insulin given? Really quick. Just really quick. Just put in the comments. You don't have to say what it is. Just really quick. Come on. Sub-Q, absolutely. All right, insulin is given subcutaneously. So you guys know that you have to inject it at what degree? When you're giving subcutaneous injections, you're giving at what degree? Right? Absolutely. I'll let y'all get that. What degree are you giving subcutaneous injections? Not 90. 90 would be IM. Wait, would it be 90? I thought it was 45. Yeah, I thought it was 45. Don't make me... Injection. Angle. Don't do this to me. Okay, it's 45 to 90. My bad. 45 to 90. 45 to 90. But yes, so that's how you would give insulin. Sub-Q, 45 to 90. Now, as far as rotation sites, what you're supposed to do is, I was taught 45, but like I said, 45 to 90. You're supposed to give it either at the back of the arm right here, back of your arm, anywhere that subcutaneous tissue, once again, is really thin. It can go into the fat. All right. They also give it, I'm not showing y'all my rows, right there and right there. But what you're supposed to do is rotate between those sites so you can avoid hypertrophy of those tissues. If you keep going to the same area over and over and over again, it's eventually just going to get really thick and, once again, hypertrophy. That's going to lower the absorption of whatever medication you put in. So in order to, really keep... Do not comment on my Hawaiian sweet rolls. Do not do that. Let me have it. Okay. But yes, you're supposed to rotate between those sites so you can distribute, all right, the love, I guess you can say, or the injection sites. You're supposed to distribute it so it's not all in one area, which will increase the risk of the hypertrophy. Okay. First of all, y'all taught me something new today, because I did not remember it was 45 to 90. Oh, it sure is too. Absolutely. Look at y'all. And then intradermal is like 10 to 15. I remember that one because it was like, whenever you try to do like a PPD for the intradermal, I'm always like, okay, is this 10 degrees? I feel like I'm 16 degrees. So let me just come down a little bit. But yes, great job. 45 to 90 for subcutaneous injections, because patient size differs. Look at y'all. Amen. I'm like everyone that said that. 2 inches below umbilical, or is it like 2 inches or 2 finger breadth widths? I forgot, finger widths away from your navel or umbilicus as well. Absolutely. Okay, y'all. I'm going through it. Ew. 45 unless it's a really large person, and then it's 90. You know, I'm trying to go through it and like all these. You better. Stomach, absolutely. 45, you can't grab no skin. See how I'm testing y'all? See how I'm testing y'all? Look at y'all. And y'all just passing all the tests with flying colors. Amen. Okay, great job. Which one was, let me go back to my thing. All right, that was, what is 3 for 500? Did I say who got that? Wait for it. I think I did. But let me just make sure. Yes, I did. It was Chriselle. Absolutely. All right, so that concludes our game of NCLEX Jeopardy, guys. All right, let's go ahead and go over our prizes and give out our prizes. Okay, let's just go ahead and do it. So first place, bad nursing student contest, you in first place, period. Unknown Beauty, aka Chriselle, with 1,000 points. What don't you have, love? What don't you have? Unknown Beauty, what don't you have? Okay, so Unknown Beauty is in the winner with 1,000 points. All right, you already know the drill, love. DM me. I already have your name and email. DM me what you would like. Second place winner, who's going to win if they don't already have an Ultimate Nursing School bundle, the digital. But you can print it all you want, and especially since you're getting this for free, so you would literally be spending less to get it printed out. Now, getting it printed out has nothing to do with me. I don't print it out specifically, but I recommend where you can get it done at the most cost-effective place that I have personally found. Okay, I don't get paid to promote these people. I don't get a slice of pie or a slice of the coin when you guys use them. This is literally me just having y'all back, because Staples and Office Depot be trying it with $200 to print out. Like, we don't have tuition to pay. But this place will literally print out 400 pages. Not this specific thing, but I did get this printed with printme1.com, with the same place that I recommend. But 400 pages, color printed and bound for $85. You literally can't beat that with a stick. I have yet to find another place that's less, unless like your auntie or whoever works for like FedEx and you can just sneak in the back and get some free printing. If that's the case, good for you. You better hold on to that. For everybody else that does not have that hookup, I'm giving you the hookup as far as that printme1.com to print whatever. The most pages they can print is 400. That's why the most that you will pay will be $85 if you use my code. If you don't use my code, it's like an extra $10. But you get that code when you purchase one of the study kits or the bundles. Okay. Once again, that is printme and then the number 1.com if you need whatever is printed. Now, our second place winner, wait for it, Future Nurse 99. Future Nurse 99. All right, with 500 points. So once again, DM me your name, your email address, your full name and email address, and confirm that it's the Ultimate Study Kit bundle or whatever other bundle that you prefer. If you already have the Ultimate Nursing School bundle, what's not included in that is the Critical Care study kit or the NCLEX Arcade workbook. Neither of those is included, so if you already have that, you're open to get one of those as well. And then our third place winner Smile 16. Hey, Smile 16. Smile 16, you have 400 points. And once again, same thing with you. DM me your full name, your email address, and confirm that it's the Ultimate Nursing School bundle that you would like. Do not leave. Everybody that stayed, I have something for you. I have another surprise for you. Everyone that stayed, 1 second. This is only for you guys because you guys stayed. Giving you guys this. Hold on 1 second. All right, 2 things. First of all, the NurseSam app has been updated. Once again, it's the free NurseSam app that literally is with white background and says the NurseSam in black and gold. That is free for all users. That's where you're going to find the mobile version of the NCLEX Jeopardy game that we just played tonight. So I just updated it so you guys can go back and replay the questions that we did and play the plenty of the questions that we didn't even get to. All right, like I said, every week I give you guys 25 brand new questions in 5 different categories so you can go ahead and really practice whatever it is you're learning and reviewing, and review like comprehensively for the NCLEX, not just a section at a time, but kind of just, like I said, comprehensively, so you're getting a little bit of each category at the same review. Once again, 100% free. Okay, this is me doing this for you guys because I want you guys to succeed. So like I said, once again, that has been updated. Right. Yep, that's been updated. So you can download the NurseSam app in your app store, iOS, Android, whatever app store, and play NCLEX Jeopardy for free. It's just been updated to reflect the questions that we just did. So once again, if you're more of a visual person, not just auditory, but you're more of a visual person like me, you can go ahead and download that app so you can play the questions and really see the blue screen, test yourself with the 1, 2, 3, 4, and, get the rationale. Just like we went over, you see exactly what we went over and exactly what I see. Okay, so you can host your own little study group, or you can quiz yourself. Give your phone to your boyfriend, give your phone to your mama, wherever, give your phone to whoever and be like, quiz me real quick. Yep, do pharmacology for 300. All right, that's the whole point of the app, so you guys can have anytime, anywhere studying. Cool? Great. So that's been updated. Now for anybody else, I'm going to give y'all 2 options. I'm going to tell which one I recommend, and then depending on whatever your situation is, you can do whatever you want with it. All right, so you guys know that I have my study bar community that is brand new and freshly launched. Okay, it is our monthly membership. You need this if you are a nursing student, no matter if you have not applied yet, if you're a nursing student in the 1st semester, 2nd semester, 3rd year, 4th year, about to graduate. Smiles, you are one of the winners. Unknown Beauty, Future Nurse, and you are 3rd place winner. So let me know give me your name, email, and if it's the Ultimate Nursing School bundle that you want. I can't remember I think you won it last time. So let me know if you want the Critical Care or NCLEX Arcade. But yes, Study Bar Community. That is our community and our membership. It is $29.99 a month. The price will increase. It's honestly worth, I literally should be charging like $75 for it. I've had countless advisors like cuss me out and say, you have this way too low. And I'm just like, back up, leave me alone. I know what I'm doing. This is for my lovely nursing students, because who can afford to pay $100 especially when you're in school, nursing school, $100 every month for a membership? That's not my goal. My goal is to help you guys, not necessarily to profit, okay? I'm not trying to be a profit shop. My whole goal is to make sure you guys have everything you need, from resources, from, how to apply to nursing school, how to get out of bedside if you want. And then while you're in nursing school, you have access to every study kit, bundle, video that I have ever made. Okay, so you have you have access to over 25 study kits. You have like over 25 videos at this point. And that's including every NCLEX Arcade, every NCLEX Jeopardy replay for the past like 3 months, to be honest. There's like 12 in there. Every Tease Tuesday replay for the past however many months, there's 15 in there. And all those are at least 1 hour each. So you're already coming in with content on content on content that's going to do nothing but help you guys succeed in nursing school, outside of nursing school, and if you want to, how to get away from nursing if you want. There's also some like business stuff, credit stuff, financial things for all the people that are interested in starting their own like nurse business or just business period outside of nursing. If you want to join that nurse entrepreneur life, we're gonna give you guys the tips and the scoops of how I did it and how I was able to after starting my business completely retire from bedside nursing very comfortably after 2 years of starting my business and after 7 years of being a nurse, 6 years of being a nurse. All right, that is going to be that sale, that $29.99 per month price is going to be for the first 100 people. So it's still going on. We just launched 2 days ago. So yeah, that $29.99. The price after the first 100 people will increase to $49.99. Okay, and that will include, like I said, that will include all the videos, all the study kits. It also includes all the NCLEX Arcade, the workbook, and the videos. You'll have access to all of that. Without that, regularly, if you just want to just have it to download and for yours to keep and actually like whatever to download and keep, you would have to pay $97 for that. But in this membership, it's like a library access. You get access to all this wonderfulness, resources, study kits, even member exclusive study kits that I have not released anywhere else but within this community. Okay, you're also getting tips and tricks on how to, like I said, apply to nursing school, how to get the job that you want, how to look for jobs in your area, how to get the best pay, how to negotiate, all that stuff. That's going to be included in there. I get a lot of people asking, hey, I'm an LPN, I'm an RN, and I don't know where to start, or I just need some tips on how to better my career or whatever. I give you all that in the Study Bar community. Once again, $29.99 for the first per month for the first 100 people. You can go to studybarcommunity.com to sign up for that. And okay, I'm back. Yes, and instantly get access to all those wonderful things, okay? That, once again, $29.99 per month, studybarcommunity.com for the first 100 people. Now, if you just want to go ahead and purchase a study kit, purchase a bundle so you can have that to download and print, you can go onto thenursesam.com and you can buy, I'm going to give you guys a discount code for you guys staying right here. 1 second. Wait for it. Wait for it. App 30. You can use the code app 30. Hold on, I'm put it right here. App 30. All right, for 30% off. All products site-wide. Yep. And that is at thenursesam.com. That does not include the membership. The membership is a community of its own that's already discounted half. All right. So you don't have to put in a code if you want to sign up for the Study Bar community. But you will have to put in this code for app 30 to get 30% off on thenursesam.com, whether it's merch, whether it's study pins, whether it's study kits and bundles, it doesn't matter. If it's on thenursesam.com, you can get it for 30% off if you use code app30. Thank you again for joining me for NCLEX Jeopardy. All right, once again, this replay will only be available in the Study Bar community. It will join the other like 15 that's in there. So if you guys just want to go ahead and sign up for that community, you can go ahead and get instant and immediate access to all the goodies I have in there. All right, more to come on that later because we're definitely going to have a wonderful launch party. More to come on that in a bit. But yes, if you guys have any other questions, please let me know. Send me a message. If you're already signed up for the Study Bar community, sending me a message there is definitely the quickest way to get me. If you guys have any type of order information, order issue, inquiry or whatever, make sure you email our support, our customer support. They're Monday through Friday, 9 to 5 p.m. Email them at support@thenurseSam.com. Like I said, if you have any order type of discrepancy, issue, or inquiry. But if you just want to talk to me about advice, anything like that, the best way to get me and the quickest way to get me, it's not going to be on Instagram. I'm going to let y'all know this now. My DMs are in shambles. Mostly because of people that ask the same question over and over and over again after I've answered it. But that's why priority is going to go to members of the study bar community. Because in addition to whatever advice, more than likely, I have some type of PDF blog or whatever, some type of resource for you to accompany whatever advice and tips that I have. So it's not just me sending you a message. I'm literally giving you resources on how to better yourself in whatever area that you need tips and tricks on. Okay. Once again, love y'all so much. We do this every Thursday, 7 p.m. Eastern Standard Time. But if you guys want to change the time to something a little bit more sooner, like 5 or 6 p.m. Eastern Standard Time, I'm going to put a poll up and we're going to vote on it. All right. This is for you guys and nothing more, nothing less. All right, guys, I will see y'all Tuesday for ATITs Tuesday. If you're not a part of that, I will see y'all next Thursday for NCLEX Jeopardy. All right. Have a good night.